Sarah, thanks so much for coming to my home.
Thank you for inviting me. It's a pleasure to be in your beautiful home.
As a heart patient, I have a condition which causes heart attacks. So unfortunately, I have had some heart attacks, but the good news is I've survived them.
Fantastic.
But staying fit and well is really important. So what is it about salt that is a problem?
Well, Public Health England makes it quite clear that cutting the salt in our diet is one of the easiest ways that we can reduce our risk factors for high blood pressure. And high blood pressure is something everybody talks about, but not nearly enough people know about. So it affects at least 1 in 4 people in the UK. It does get more common as you get older. And the reason that salt has an impact is that it basically disrupts the natural sodium balance in your body. That means that your kidneys can't get rid of water as well as they should if they need to, and that means more fluid in your system. What we do in the UK on average is we eat about 8 grams a day. The message from Public Health England is that if we all cut our salt intake by 1 gram a day, then that would prevent over 4,000 people every year dying early from heart disease. So what we're looking for is to go down to not more than 6 grams a day. Vast majority of people are going to get more than enough from everyday foods without adding it. But if you do like the flavour, then absolutely by all means think about a low sodium alternative.
There are certain items that I desperately like to have a little bit of a salty flavour on, and that's potatoes and tomatoes. I can live without it on everything else, but it really salted caramel ice cream, maybe. Yeah, you've got me there. So then talking about flavouring food, because we do like the taste of salt.
We do.
Rock salt, sea salt, table salt, it's all salt. I've heard people say it's different, and people say it's healthier if you have rock salt or pink Himalayan salt. I know the answer.
Posh salt is salt. It's the sodium in the salt, and they all have exactly the same amounts of sodium.
As a heart patient, I use low salt, and it is a mix, I know, of sodium but more potassium. And I know there has been a query about the potassium in heart patients, so can you just clear that up for me?
SACN, which is the Scientific Advisory Committee on Nutrition, has looked at all the studies on this, and they've looked at the risks and they've looked at the benefits. So the risk with using low sodium alternatives which contain more potassium instead are for people particularly who've got so-called severe chronic kidney disease, kidney problems. And the World Health Organization says it shouldn't be an issue unless you have what we call stage 4 or stage 5, where your kidneys are working at less than 40% capacity. 99% of the population don't have that problem. Some people who have high blood pressure and are taking blood pressure lowering tablets are taking medication which could increase their potassium. So if you are taking high blood pressure medication, it is worth checking with your GP to make sure it's safe. But basically SACN has said that at a population level the risks absolutely are outweighed by the benefits. If you had your top tips for small steps, one at a time, towards a healthier you in the kitchen, what would they be?
First step would be cut down, if you can, on processed food. Just try to grade it down so you're eating less and less processed food, and start cooking from scratch more. And that doesn't have to cost more.
No.
If you go for things like frozen vegetables, they can be really affordable. They're pre-prepared. So if you want to spend money on pre-prepared food, filling your freezer with frozen vegetables is really useful.
But even pre-prepared ones, they don't need to be expensive. You know, own brands or whatever.
Absolutely. And the thing about frozen is they're often fresher than fresh. If something's been sitting around on a supermarket shelf for 3 weeks, and actually the frozen is much fresher. So that's the first thing. And then small changes, small steps. So try to cut out and do away with your rock salt and your posh salts, or even good old table salt, and go for a low sodium alternative. I use low salt. Because those small steps can actually make big changes over time.
Absolutely. Sally, thank you so much. It's been a real pleasure.
Well, thank you for coming and sharing all your great advice.